Your thyroid is a tiny gland in your body, but it controls some major functions throughout your body. Issues with the thyroid can result in small, harmless problems, such as a goiter, to serious life-threatening cancer. Today, we'll hear from a patient who experienced this issue, as well as a surgeon who treated her. We'll also have a family physician and a specialist to tell you the signs to look out for when you need to seek treatment. That's coming up today on Stronger Together with Dr. Dave. Hello and welcome to Catholic Health, Stronger Together with Dr. Dave. Today we're talking about potential issues with your thyroid and how to treat them. My first guest is your first line of defense when it comes to thyroid issues. I'd like to welcome Dr. Jasmine Philip, a family medicine physician at Catholic Health Ambulatory Care at Riverhead. Dr. Philip,
hello.
Thank you for joining us.
Thank you for having me.
So I always feel that the thyroid is something lots of people talk about, but nobody knows exactly what it is or where it is. So Tell me a little bit about the thyroid gland.
Sure. So the thyroid gland is a small butterfly-shaped gland located in the front at the base of the neck. It is a small gland, but it has so many important roles in the human body. It impacts pretty much every organ system and function within the human body. The thyroid gland produces several hormones, such as T3, T4, calcitonin, and these hormones, which are chemical messengers, circulate through the human body and have control over brain function, heart, kidney, liver function, digestive system. There is impact on temperature regulation, on our skin. For women who are menstruating, there is an impact on the menstrual cycle. So it is really quite an important gland to be mindful of, only because of how much it impacts our bodies.
So there are a lot of symptoms that can be caused by a thyroid that's malfunctioning. It sounds to me that there's a lot of overlap with thyroid disease and a lot of other things, like sleep deprivation, weight gain, weight loss, anxiety, depression, palpitations. So patient comes into your office with vague complaints. Are you thinking you need to definitely check their thyroid?
So there are many symptoms that folks will come in with where we will absolutely keep the thyroid gland in mind, meaning making sure that the thyroid function is being tested, as well as ruling out and checking other things. So for example, a common complaint, a common concern that people come in with is fatigue. Doc, I'm tired all the time, I'm getting sleep, but I just don't have energy, I just don't feel right. I think it's my thyroid. And from there, that will lead us down a pathway to order lab work and other testing. Having thyroid disease is complicated because there are so many signs and symptoms. So for example, people who have an underactive thyroid function, which is known as hypothyroidism, many folks come in feeling fatigued, feeling or having symptoms of constipation, dry skin, feeling cold all the time. They may notice that they're gaining weight. Or we could have just the opposite, where a person has an underlying thyroid condition where the thyroid gland is working very hard, the function is very fast, so that's known as hyperthyroidism. In that instance, folks may have symptoms of weight loss. Their skin may feel kind of sweaty. They may notice palpitations. Their heart is racing, an irregular heart rhythm. They may feel anxious or irritable. But with that said, I think it's important, if you have any of these symptoms, to come in for a checkup, go see your doctor or primary care provider, because it may not be, as you alluded to earlier, it may not be the thyroid alone. It could be another underlying problem. A person could be anemic. They may have a sleep disorder. They may have diabetes that has never been picked up.
At what point do you initiate treatment? Do they have to be symptomatic, or would you treat based on the lab tests alone?
So if a person's thyroid function, their TSH level shows that they're starting to fall into a hypothyroid range, and yet generally if they're feeling well, if the number is at a somewhat elevated level but not super high, we tend to monitor. We tend to watch that person very closely.
Without symptoms, if they're not having
Without
symptoms.
symptoms,
Okay,
right.
gotcha.
But if they do start displaying symptoms of, again, feeling fatigued, they're gaining weight, they notice that with their digestive tract, they're starting to get more constipated. If they are starting to display more and more symptoms, then absolutely we will start treatment. If the opposite takes place, where a person's TSH level is now revealing they are hyperthyroid, then I tend to refer out to an endocrinologist earlier rather than later, because having an overactive thyroid state can quickly impact, for example, the heart, inducing abnormal rhythms. So therefore, I do want to get it treated soon, as soon as possible.
Gotcha. Very interesting. And what age should we start screening people for thyroid disease?
So I think for most adults, when they come in for a checkup or a physical, I like to draw a baseline level to see where they're at. And of course, if I do hear of other concerns, complaints, then I will include it.
Got it. So people watching this show should make sure at some point their primary care physician is at least checking their thyroid.
Sure.
Great. That's really helpful. And I want to thank you for taking time out of your busy schedule to come in and talk about this really important topic.
Sure.
Coming up next, we'll hear from an endocrinologist who will go over specific issues caused by thyroid disease and what you should do about them. You're watching Stronger Together with Dr. Dave.
As farmers and ranchers, stewardship of the land comes naturally. We help keep water clean, improve the soil, and provide habitat for wildlife. But did you know that conservation can also improve your bottom line? Learn more at conservationpays.org.
Welcome back to Catholic Health Stronger Together with Dr. Dave. Today we're talking about your thyroid and potential issues it can cause. My next guest is Catholic Health Endocrinologist Dr. Maria Pena. Dr. Pena, welcome to the show.
Thank you for having me.
So you're an endocrinologist. Explain to the viewers, what exactly is an endocrinologist? So
an endocrinologist is a doctor that specializes in all the glands of the body. So I always tell my patients from head to toe, that starts with the pituitary gland, which we also like to call the master gland. It really regulates all of the other hormones in the body, including the reproductive hormones, signals the thyroid, signals the ovaries, the testes, amongst other things, the adrenals. Then we go down to the thyroid gland, right? So you have your thyroid gland that receives that signal from the pituitary and produces active thyroid hormone. Of course, I'm simplifying it, but that's the general gist of what the pituitary and the thyroid do. Next to the thyroid gland, you have the parathyroid gland. Para in Latin means next to. So even though they're very close to each other, they have no interaction with each other. The parathyroid gland regulates the calcium and vitamin D in the body, and any disorder of the parathyroid gland can affect your bone health. Now we go down to the pancreas. That's the organ in the abdomen, and it's responsible for producing insulin levels. Any abnormality in insulin production can lead to diabetes, either type 1 or type 2 diabetes. Then we go further down, and then we have your adrenal glands. Your adrenal glands, many people know as adrenaline. Adrenaline consists of many other hormones, epinephrines, cortisol levels, for example. So as an endocrinologist, we look at the adrenal glands, make sure they're working properly. We don't want too much adrenaline in the system, and we don't want too little. So that's an overall explanation of what an endocrinologist does. So that means, for example, that we take care of reproductive disorders such as polycystic ovarian syndrome. That's a common disorder in women, young women usually. They present with acne, facial hair, irregular menstrual cycles, for example. Men that have what you know as low testosterone. Women that are going through severe menopause symptoms. Sometimes you can give them some hormone replacement therapy. When in the right patient, it's actually very safe and effective. You also deal with obviously diabetes, the entire spectrum of pre-diabetes, diabetes type 1, diabetes type 2. We also deal with osteoporosis, amongst other things, and thyroid issues. In my specific practice, I also have a special interest in obesity medicine and in cardiometabolic disease, since diabetes and heart disease are so linked in together.
In plain English, what does the thyroid do? Why do we need a thyroid?
So the thyroid produces a hormone that has a receptor throughout the entire body, meaning you have receptors or little, you could say like almost like a little button throughout in your brain, in your heart, for example, in your gut, throughout your entire system. So thyroid hormone is necessary to help, for example, in women with your menstrual cycle. If you have, let's say, too much thyroid hormone, what happens with too much thyroid hormone? You have fast heart rates, right? Because now it's stimulating the heart. It can give you diarrhea when it's overactive because it stimulates the gut. So I'm just giving you an example of what happens with the thyroid. It affects the entire body. People, for example, can experience hair loss, right? Because you have receptors in the hair. It can affect your skin. It can give you constipation when actually the levels are a little bit too low. So in both extremes, right, you can have symptoms: skin disorders, hair disorders, energy level. In both cases, actually, people have this idea that low thyroid can cause fatigue, but so can overactive or high thyroid, because that can just wear you out. But many of the classic symptoms are that energy levels are affected, your appetite can be affected. As we all know, weight can be affected. I get a lot of that. But let me tell you, I see more drastic weight changes, so weight loss with the overactive form. When it comes to weight gain can be affected if your thyroid is low, but only by 10, 15, 20 pounds. Anything beyond that is most likely due to lifestyle changes, diet, or other things. But that's kind of an overall gist of what the thyroid does. It really affects the entire body, again, head to toe.
Right, and I think what's really important for people watching this show to understand is your doctor really needs to think about the thyroid, because it's not the type of thing that's really obvious. It could be very subtle, like you were saying, sleep disturbance, hair loss, weight gain, weight loss. So, you know, it's something that has to be in your differential diagnosis. Absolutely. When somebody's coming into your office,
Palpitations, for example, that's a very common one. You have a fast heart rate, or new onset anxiety. All of a sudden you're very anxious and having tremors. Tremors is another one I have. You have a fine tremor, make sure you check your thyroid. So all of those things have to be thought of when you're, like you said, you have that symptom, you want to think about the thyroid as well.
Right, a lot of people, especially women, are told they have anxiety, and it's not even anxiety. They have either very high or sometimes even low thyroid, and it's manifesting as anxiety or depression.
Exactly,
even. So,
absolutely.
So we have to think outside the box sometimes as doctors that, you know, if somebody comes in with these vague symptoms, we need to cast a broad net.
And even borderline levels. So sometimes there's something called subclinical hypothyroidism or subclinical hyperthyroidism. In both cases, let's say the patient is symptomatic and they happen to have that abnormality, I've noticed that by correcting the thyroid, those other symptoms go away, or at least their other problems that they may have get a little bit better when you treat the thyroid along with whatever other problem they have. The same I've noticed with psychiatrists. Let's say they have a patient who has depression. They will send them to me, say, hey, can you optimize a thyroid so they can respond better to their psych treatments, for example.
Yeah, excellent. Well, this was fantastic. I mean, it was such a great overview of endocrinology and thyroid disease in general, and we'll definitely have to have you back on the show. But thank you for joining us today.
Thank you for having me.
Coming up next, I'll be joined by a head and neck surgeon who will tell us the treatment options available for patients with thyroid cancer. You're watching Stronger Together with Dr. Dave.
Got your personal references, high school diploma or equivalent?
Skip the drama. Get your diploma.
It's right there.
Find free adult education classes at finishyourdiploma.org.
For more than 100 years, American Humane Association has been teaching kids to be kind to animals. Those in our homes, on the farms, on the silver screen, and wildlife conservation, caring for the world's vanishing creatures. But we can't do it alone. Visit kindness100.org to find ways to teach kids how they can make a more caring, compassionate, and humane world for all of us.
Welcome back to Catholic Health, Stronger Together with Dr. Dave. My next guest is Catholic health surgeon Dr. Arnbjorn Toset. He specializes in head and neck surgery and has vast experience treating thyroid cancer. Dr. Toset, thank you for joining us today. I could not think of a better person to join us about this very important topic of thyroid cancer than yourself. And I hear that you have been appointed a very important position starting in the fall. Tell us about that.
Correct. Thank you, Dr. Dave. It's my pleasure to be here today. Yes, I've been working with Catholic Health for the last 12 years at Good Samaritan University Hospital, and I'm honored to take on the first director role for head and neck surgery for the hospital, and that's starting this fall.
That's fantastic. Is that a new role for Good Samaritan University Hospital?
Yes, it is.
So this is a very specialized role of head and neck surgery.
Correct.
Fantastic. So, okay, well, let's get to it. So how common is thyroid cancer?
Thyroid cancer is quite common, specifically among certain patient demographics. We see about 70,000 cases of thyroid cancer in the US annually. It's more prevalent among females versus males, about 3 times more common in females. And it's a fast-growing cancer. Its incidence has increased 3-fold over the last 25 years.
Well, any explanation for that? Do we know why?
There's no definite explanations for it. We were thinking in the beginning it's more due to more awareness and more scans and incidental findings on imaging in general, but that would only be true for small types of cancer, but we see all kinds of thyroid cancer, so not really sure why, but same as with other cancers, they tend to become more prevalent with time.
And there are different types of thyroid cancer?
Yes, yes.
So is there one thyroid cancer that's more common than the others?
Yeah, so there are 4 types of follicular, what we call them, follicular thyroid cancers. There are 4 types. The most common type is called papillary thyroid cancer. We see about 80% of those types of cancers. And then there are 3 less common types. One is called follicular thyroid cancer, another one is hurdle cell. We see about 15% of those. And the least common type is anaplastic thyroid cancer, about 2 to 5%. And they all behave very differently.
Right, so it's really important to have a biopsy and understand the type
Correct.
of cancer you're dealing with.
Yes.
A lot of times we'll hear patients say, oh, I feel something here and I'm nervous. And so when you see a lot of patients who are on physical exam told they have a nodule and they think it's a thyroid, they may or may not have had an ultrasound.
Right.
What's the first thing you say to a patient when they come into your office and they're wondering what's going on?
Well, first of all, I will repeat the exam and try and elicit, the symptoms and have a feel for what it feels like, and then the next step would be imaging. If it's the thyroid nodule, which is something I can feel on exam, then the next step would be a simple ultrasound of the thyroid gland. If it's more related to a node on the neck, lateral neck, then it would be a CT scan, which would be the best next step for that patient. There are a few different cancers that can cause a node in the neck. A lot of cancers in the head and neck region will present themselves with a node in the neck, so it's important to do a thorough head and neck exam, including the oral cavity and looking in what we call the oropharynx, the back of your mouth, etc.
Right, it's important to have somebody such as yourself who has examined tens of thousands of necks in your career.
Yes.
But is it safe to say that when somebody comes to you with a thyroid nodule, statistically, most nodules are benign?
Correct.
Okay.
Yes. So thyroid nodules are very common. See them in about 50% of the population in general. Most of these nodules turn out to be benign. 5 to 10% in general turns into becoming a cancer. They have very specific characteristics which I look for on an ultrasound, which will determine if your nodule is something that should be biopsied. And the ultrasound is the best study to determine that.
And finally, if you have a biopsy that's positive for thyroid cancer, what is the typical first step for treatment?
Well, the first step would be to ask your doctor to be referred to a surgeon who deals with thyroid cancer, someone who's had specific training dealing with thyroid cancer. That would be very important.
Somebody who's experienced, and this is what they do day in and day out.
Correct.
Still to come, we've covered several aspects of thyroid disease. Now we're going to hear directly from one of Dr. Toset's patients who is going to share the details of her journey with thyroid cancer. That's next on Stronger Together with Dr. Dave.
He helped helped me learn to read.
It is the best feeling in the world. They impact me. I'm proud of the work that I'm doing.
There's been dramatic results in our kindergarten classroom this year from having a foster grandparent.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Welcome back. Today we're talking about thyroid cancer, what it is and the different issues it can present. My fourth and final guest is Dana DiMartino, joining Dr. Toset to share her firsthand experience with thyroid cancer. Dana?
Hi, thanks
welcome.
for having me.
Thanks for coming on to the show. Your story is fascinating, so I'm just going to get to it because I really want to hear everything. So you're going to take us, the viewers, back to December 2021?
Correct.
You're washing your face.
Yes.
Tell us what happens.
So I was washing my face. I looked up in the mirror and I noticed that I had a large swollen part of my neck. And so I panicked. I woke my husband up and I was like, something's wrong. I think I need to see a doctor for this. And so that led us to Dr. Toset.
Wow. So, I mean, you never noticed this before?
No.
So that something about that moment that struck you, that something in your neck was not right.
Correct.
So you see Dr. Toset, who is at the same hospital
yes.
that you work at, ironically.
Yes.
And you meet with Dr. Toset, and what are you thinking, Dr. Toset, when you examine Dana?
Well, the first time I met Dana, she was feeling quite miserable. She's gone through a few months of not feeling right, feeling exhausted, tired.
I was very tired. I was gaining weight. I just, in general, didn't feel like myself anymore. I was getting frustrated. I didn't change anything about my diet, my exercise routine, and I just knew something wasn't right.
And you never thought about thyroid being an issue potentially?
No, not.
Who would think of thyroid,
no,
right?
Yeah.
You're busy, you're working, maybe it's just that, right?
Yeah, you blame it on everything else.
Of course, yeah, we all do that. So, but you don't feel that way. So something there, I mean, this is what you do. So there are red flags all over the place,
totally,
right?
Totally.
Okay, so you're listening to her story, you're already not liking it, and then you examine her, and what happens?
Yeah, well, I examined her, and right away I could appreciate a very large gland, something we call a goiter. And I also felt a nodule in the isthmus portion of the gland, which is the thin membrane between the two sides, which felt quite suspicious to me on exam. So we had a talk. I explained to her that her symptoms sounds to me to be related to something we call Hashimoto's disease, which is an autoimmune condition. Which attacks the thyroid gland and causes a lot of the symptoms she was experiencing at the time. And we also discussed the fact that I felt a nodule which was suspicious, and I wanted her to have a biopsy.
Yes. So I had a biopsy and it was negative, but I had also made an appointment to see an endocrinologist, and I was waiting several months for that appointment. So after
several months for that appointment?
Yes.
Okay, but you were feeling better because you were told that the biopsy was negative.
Yes.
Okay.
Yes.
So he's not going to let this sit. I know it. So you look at the biopsy, and then you're trying to figure out on your exam that's suspicious. How does that match up with a benign biopsy? Doesn't make sense. So what were you thinking?
Yeah. So exactly what you were saying. So. A biopsy is a helpful tool, no different than any other test, but you have to go by the clinical picture and how something feels on exam, and I was not happy with how it felt, so it felt too suspicious to me for a typical cancer, so I said, we need to repeat this biopsy. And the endocrinologist you were seeing, she performed the biopsy for us.
She performed the biopsy, and about 3 days later, she called me to say, I have unfortunate news. You do have papillary carcinoma.
Same nodule they biopsied the first time. The second time came back with cancer.
Yes.
Mm-hmm. Okay, so I just want to pause for a second because there are a lot of people watching this show, and this is critically important. Anybody can do a test and read a test, but it's the master clinician that takes it to a step further, and that's what Dr. Toset is. You really are a master clinician. Years and years and years of experience, his hands feeling thyroid glands and noting when there's something bad and when there's something not, regardless of what even a biopsy shows. That's amazing. So you pursued, we have a diagnosis of cancer, things change dramatically. What happens next?
So I was scheduled for surgery. I saw Dr. Toset. We had a plan. He was going to hopefully just take out part of the thyroid, but when he did get in there, the goiter was so large and the tumor, we were uncertain if it had the margins that he needed, so he ended up taking out the entire thyroid. And with that, I did end up with a more extensive surgery and came out of surgery with a drain in my neck, which did cause me to spend the night in the hospital. The original plan was to go home the same day, but that's okay because I was taken care of.
Right, and you had a huge thyroid, so this was a big surgery. This was not a typical surgery by any means. Were you cured? Is this a cure?
Yes.
Yes.
In her case, and then for this specific type of cancer, it's very curable. High cure rates.
No radiation, no chemotherapy?
No
after this?
radiation, no chemo. But like Dana said, her gland, a portion of her gland extended into her chest, and which also made me a little worried at the time, and wanted to make sure we didn't have to go back there again with the cancer diagnosis. So I made a decision to remove the entire gland at the time of surgery.
Right. And you don't need your, I mean, we could supplement thyroid with Synthroid or some other, substitute. So that we could live without a thyroid. We are able to do that.
But we try to be conservative and save the gland or a portion of it if possible.
Right. So we're gonna wrap this up, but I do want to bring home the message to the viewers that, again, you need to be your own advocate, right? If you see something that's not right, even if your doctor says it's okay, even if you have a biopsy that initially is negative, continue advocating for yourself and find somebody who knows what they're doing, who has, like Dr. Toset, tens of thousands of hours of experience dealing with thyroid. He's the guy I'm going to if there's ever an issue. You really need somebody experienced. So
he's very knowledgeable, very caring, very attentive, and he's known in our community as the butterfly surgeon.
Right, because the thyroid is a butterfly-shaped organ, right?
Yes.
So this is great. But thank you both for coming in, because this is really important. I hope we help somebody who's watching. If we even help one person, this is all worth it.
Yeah, thank you.
Thank you for having me.
Thank you, Dana, for sharing your story. I know it will help someone who is watching today. As we learned today, there are some excellent experts across Catholic Health who can help you identify potential thyroid issues and seek treatment before it's too late. If you would like to know more about Catholic Health or to make a gift in support of one of the amazing programs you heard about today, visit chsli.org or call 1-855-CHS-4500. Thank you for watching today. I am Dr. Dave Degatti, and I'll see you next time on Catholic Health, Stronger Together with Dr. Dave.